And I feel like his last email came in a really unusual way. Like it came in to my spam, which made no sense. So he had said, hey, I'm not going to be there today, the last time we had a meeting. And somehow it went to my junk mail, which made no sense.
Okay.
So let me make sure there's
Yeah.
not.
I'm back into May and I'm not pulling anything, but we can always figure that out offline.
Okay.
So I am clearing the waiting room. It is just now
Okay.
2 o'clock.
Okay.
I see Donna, Sherry, Alicia. I'm trying to scroll through and see who all's logged in. So I would like to give a friendly reminder. We're doing this to all the TACs. When you speak for the first time, make sure to say your name so that the court reporter can catch who's speaking. So that way we can just make sure that we can capture that correctly in the transcript.
Okay. So we now have how many named members? What do we
You
have?
have 6 and I have 3. Oh, 4. It looks like Courtney is coming in now.
But okay, so
So
we have
once
one,
she
right?
logs in,
Okay.
and let me see if either one of your Amandas have moved in.
Kelly, Karen and Donna, I forwarded you the email from Michael Flynn, saying that, maybe we talked to people in this way. You just forwarded that? Yes.
Okay, so that is our other Amanda. So we have a Mandy Heacock and and Mandy Ashley. Okay. So I do have, thank you, Kelly.
You're welcome.
Okay. Donna, I do see that you have a quorum. I don't see either Mandy's logged in yet. I do know Amanda Ashley was having an issue and Kelly was working on sending her the link to get her in. But if you want to go ahead, I can let you know when the other 2 join.
Okay. Yeah, that was going to be the first item on the agenda, was welcoming the new members. So she's currently trying to get in, is that correct?
Yes, I sent her the calendar invite and it wasn't working. So I had Kelly send her the website information so she could
Okay.
log in from the website.
Okay. I guess I could go ahead and welcome everyone who's here. We do have a couple of new members, and hopefully they will be joining us shortly, and we would like to let them introduce themselves. But if you are here with one of the MCOs or with DMS, if you could put your information in the chat so we know you're here. We do have a quorum, so we can vote on the minutes from July the 12th. Do I have a motion from one of the TAC members?
I motion approval of minutes.
And do I have a second? Thank you. All in favor? Aye.
Aye.
Okay. Any opposed? Okay, very good.
Donna, one of your Mandys just joined, but it just says Mandy, so I don't know which one.
Okay. Well, hopefully, I would like, let me go back to the first item on the agenda, which is to welcome our new members. I believe we have a new member of the TAC who has joined us. So if you could introduce yourself, and the other TAC members, we can also introduce ourselves and talk briefly about our what organizations we represent.
Mandy, were you able to get logged in?
Mandy, are you there? I see a Mandy. Is this?
You don't want to mute it and introduce yourself.
Wait, are we on here? Okay.
Hello, hi, this is Dr. Ashley.
Welcome to the TAC or to the Child Health TAC. Can you tell us a little bit about yourself?
Yes. So I'm a pediatric dentist. I'm now in my 25th year of practicing dentistry. I own a practice here in South Central Kentucky, in Bowling Green, Kentucky, Hopkinsville, and Glasgow. We see at least 60% of our total patients with Medicaid. And I feel like with my background in public health from my 11 years in the Indian Health Service in Barrow, Alaska, and with coming, working day to day here on the ground in South Central Kentucky, I might have a bit to offer as a provider that sees a high number of kids with Medicaid and just some of the challenges that we face.
Well, thank you so much and welcome to the group.
Thank you.
We are happy to have you with us. I'm Donna Grigsby. I am currently the chair of the Child Health TAC. I am a pediatrician at UK, and I'm representing the Kentucky chapter of the American Academy of Pediatrics.
Hi, Mandy. I'm Courtney Smith, and I'm the co-chair of the TAC, and I'm a clinical psychologist, actually a pediatric psychologist working at the University of Louisville and Norton Children's Hospital. I'm actually the solid organ transplant psychologist, so I work mostly in the hospital and the medical clinics.
And hi, Mandy, I'm Sherry Dymar. I'm with the Kentucky Parent Teacher Association. And we not only try to help parents get more involved in the schools and be in leadership positions in the schools as parents, but also we do a lot of advocacy work around the areas of health and safety.
All right, thank you.
I failed to say that I represent Kentucky Psychological Association. Sorry about that.
All right, thanks.
And Alicia, are you here? I thought I saw her.
She was here a second ago.
Yeah, I thought she was here.
She's turned her camera off. Maybe she had to step away briefly.
Oh, okay. When she comes, I'll keep my eye out, and when she comes back, hopefully she can introduce herself. But Alicia is with Kentucky Youth. Oh, there she is. Hopefully, Alicia. Yeah. Alicia, can you hear us? We were just introducing.
Hi, my name is Alicia. Can you hear me?
Yes.
Maybe not. Can you hear me? Sorry.
Yes, Alicia, is that you? We can hear you.
Okay. Yes. Awesome. Sorry, I'm having some internet issues, so I had to switch over. My name is Alicia Watley. I'm with Kentucky Youth Advocates. And so we work on a lot of health policy as it relates to kids in the state.
All right, and we'll keep our eye out. We have one more new member who's taking Michael Flynn's place. She may not have been able to join us today, but we'll definitely keep an eye out. So welcome to our new members, and thank you to our not so new members for being here today. We have approved the minutes, so we're going to move forward. I'm always very respectful of everyone's time. So we're going to move to old business, which is the DMS report on social determinants of health. For those of you that were here last month, and for those of you that are new to us, we actually had wonderful reports last meeting 2 months ago from our MCOs about all the services that they provide to families, particularly those that are facing homelessness. And so DMS is going to give us a report on kind of their resources for social determinants of health. I'm not sure who's speaking to us, but I'm going to be quiet now.
Hello, Donna. This is Angie Parker. I'm the Director of Quality and Population Health, which part of the social determinants of health. We have a branch for that, but who will be speaking on the topic one social determinant of health is the access to transportation, and that's Rachel Rarig. She'll be going over that presentation.
Okay, thank you. So Rachel, would you like to start?
And Donna, just to cut in really quick, it looks like our other new member, our other Mandy has joined.
Oh, perfect. So let's see, I know I'm trying to look at the screen to find Mandy Peacock. Mandy, the members of the TAC just introduced ourselves. So if you would like to, since you're the newest member or one of the two new members, would you like to introduce yourself and tell us a little bit about yourself?
Sure. Can you hear me?
Yes.
Okay. I'm Mandy Heacock. I'm a Youth Service Center Coordinator in Frankfurt at Bondurant Middle School and Western Hills High School.
Okay. And you're representing the Friskies, I believe. Is that correct?
Yes.
Okay. Wonderful. Well, welcome to the group. Okay. Let me turn it back over to Rachel.
Thank you, Donna. And good afternoon, everyone. Give me just a minute. I'm going to share my screen. Okay, can everyone see this all right? All right, good deal. So we first presented this to the disparity TAC, and it was requested to be reiterated here. So we were very happy to do that. Our goal with this particular bit of research was to combine all current transportation options that are currently available to Medicaid recipients and to have that in one place so that we have a more holistic understanding of what access to care the families and the Medicaid members currently have available. So as we go through, we're going to review transportation that's provided by the state, different ones by the MCOs, by community-based organizations, and through public transportation services within a targeted area. The area that we targeted for this presentation is in Eastern Kentucky. So why did we choose to look at Eastern Kentucky specifically? We've identified 27 different counties whose population consists of 50% more that make up the Medicaid members compared to the population of that county. So these counties are highlighted here in yellow on the Kentucky map and are predominantly in Eastern Kentucky. Here we have a graph that shows the enrollment in the targeted 4 areas or 4 regions that are based on the identified counties in Eastern Kentucky. That is broken down by the MCO enrollments for those members. So the top MCOs for that targeted area is WellCare, that's shown in green, followed by Aetna, that's shown in red. Similar to our previous Kentucky map showing the Eastern Kentucky area with the highest Medicaid population compared to the county population, this map also shows with the dark green areas in there, the worst health outcomes across the state are also mostly and predominantly located in Eastern Kentucky. So for these reasons, we're going to take a closer look into what transportation services are available to Medicaid members in this specific area and the utilization of those services that are taking place. Here we have the 3 different transportation options that are provided by the state. So we have emergency ambulance transportation services, non-emergency ambulance transportation, and the most widely known and used non-emergency medical transportation. So it can get a little complex. So to break down how it works for Kentucky, DMS contracts with the Transportation Cabinet to oversee all Medicaid transportation services. The Transportation Cabinet oversees the Human Service Transportation Delivery Program, through which there are 16 regional brokers that can either provide the transportation services themselves or subcontract with other transportation providers that are in their specific area. If a rider does not express a preference, then the broker will select the provider for them. And the transportation type will depend on the transportation that is accessible for the client and appropriate to meet their medical condition and personal capabilities, while also being at the lowest cost. Transportation brokers are the only ones who can schedule NEMT services. Their other specific tasks are shown here, broken down, and they can utilize subcontractors to provide the NEMT rides by taxi, sedan, stretcher vehicle, public bus tickets or bus passes, accessible vans, and private automobile rides. These are the details on how Medicaid members can request those NEMT services in general. So this is for you all to have to review and refer back to as needed. So we're going to take a closer look at NEMT. And what we found is that trips are continuing to rise, nearing pre-COVID levels. Approximately 240,837 trips per month were utilized by Medicaid members from July 1st, 2022 to February 28th, 2023. So there's no caps on the number of times a member can schedule a needed trip to a service. Transportation is available in all 120 counties. There is a 72-hour notice that's required for scheduling. And transportation after discharge from the hospital can be requested during normal operating hours without that prior notice. All transportation services are ADA compliant. So DMS has proposed regulation changes to help related to transportation. That includes removing the current restriction that members currently have for requesting NEMT services, in which they cannot have a vehicle in their own household in order to be NEMT eligible. A vehicle cannot be in the individual's name unless there's a doctor's note stating that they can't operate the vehicle, or a mechanic's note saying that it's no longer in operation. There's also a proposal to allow parents or guardians of minors to request a 2-week exemption for the child for Medicaid covered service trip with their parent or guardian, as they have the same ownership status as their custodial parent or guardian. Transportation providers will no longer be able to self-refer members. And upon approval of the 1115 waiver, NEMT will also be provided for methadone treatment services. Additional NEMT data is that for fiscal year 2022, there were 2,385,922 trips provided for Medicaid members. Urgent care transportation is available 24/7, including holidays. Urgent care is defined as an episodic situation in which there's not a threat to life or limb, but the recipient needs to be seen within 12 hours in order to avoid the onset of an emergency medical condition. So this does not include an emergency trip that is to be addressed by qualified emergency services. Transportation to the emergency room is not covered through NEMT unless there is an order for a direct hospital admit through the emergency room. Of importance is for those that need to bring a child or other individual to their appointment, it is 100% up to the transportation provider that's actually providing that transportation service to the client directly to provide the transportation without charging them for the child or individual. Depends on a lot of different factors, but mainly the availability of seats, and if the other seats have been purchased by other members that need to get to their appointments. Vehicles used in the program consists of revenue producing seats. So for the transportation provider, it's up to them if they will allow a member to bring someone else without charging them. Usually this is not an issue. The way that it works is the member is put in contact with the transportation provider directly by the transportation broker. So that way the two of them can work out those logistics. Medicaid doesn't have the authority to make that decision. Only the transportation provider has that ability. And most subcontractors do allow members to bring child in most circumstances. So now shifting to the MCO world, MCOs can provide additional assistance for their members through value-added benefits. A value-added benefit is defined as any benefit or service that's offered by the MCO with that benefit or service, or when that benefit or service is not a covered benefit per the state plan. So these benefits are additional and they're subject to change annually as determined by each specific MCO. So breaking down these value-added benefits for 2022 by MCO, we have Aetna Better Health of Kentucky that offered 2 transportation value-added benefits. One called Enhanced Transportation, that was for going to job interviews, training, going to the grocery store, community health services. And there were 5 members that utilized this service in those 27 identified counties in the year 2022. The second value-added benefit is called Family Transportation, and that's for members enrolled in their Maternity Matters program that can receive transportation provided for the family, including a car seat for children. However, there was 0 members in those 27 identified counties that utilized that service. Both value-added benefits are limited to 10 round trips per year. For WellCare, for 2022, they did not have any current transportation value-added benefits. What they are able to do is make referrals to Kentucky's NEMT program through their Community Connections helpline. The referrals include general transportation support and medical transportation support. We found that 52 members utilized the general transportation services offered by WellCare in those 27 counties in 2022. There's 52 members. There was 83 members that utilized the specific medical transportation value-added benefit or referral in 2022 for those targeted counties. And the highest number of referrals to the NEMT program was through WellCare was Floyd and Perry County. United Healthcare doesn't currently have any transportation value-added benefits. They offer non-emergency stretcher transportation as their value-added benefit, in which it's not provided through NEMT transportation brokers. And there were 0 members that utilized that resource in 2022 within those 27 counties. Anthem offered 1 transportation value-added benefit in the form of a $50 gas card, bus pass, or Uber card. And that's for all members that are age 18 and over that completed a health risk assessment within the first 6 months of the year and a wellness check within 12 months. They could obtain this benefit on a quarterly basis with a max allowance of $200 per member. With the highest utilization thus far, 658 members utilized this value-added benefit in those 27 counties in year 2022. The top counties of utilization was Whitley, Knox, and McCreary. And the gas card, bus pass, or Uber card has increased for 2023 on a biannual basis to $100. Passport by Molina Healthcare offers 2 transportation value-added benefits, one in the form of a $50 gas card, bus pass, or Uber card. Similar to Anthem, however, the qualification in order to get that value-added benefit is a bit different. This is only for members that are already engaged in supportive services through case management. So they have been identified as needing a higher level of care, higher level of need for those case management services. There were 40 members that utilized this value-added benefit in those 27 counties in 2022, with the top counties being Whitley, again, Knox, and Johnson. The second value-added benefit that Passport provided is a reimbursement program for lodging, meals, and transportation to medical appointments. Dependent on enrollment in case management, similar to the first value-added benefit, and there's other stipulated limitations. 19 members utilized the reimbursement value-added benefit in 2022, with the top counties being Bell, Magoffin, and again, Whitley. Humana Healthy Horizons is not currently offering any transportation value-added benefits. Instead, similar to United, case or care managers makes referrals to Kentucky's NEMT program for their members, and they provide follow-up with the member to confirm the transportation scheduling was complete, that they have any follow-up visits scheduled and taken care of on that end. There was a total of 36 referrals made in those 27 counties using this approach in 2022, with the highest number of referrals being in Lawrence County. Of note, Humana also has 2 pilot programs that include maternity transportation in Louisville and a bus pass pilot program to members receiving care at 7 county services. At the very end of this presentation in the appendices, there is a much more thorough breakdown of this information for you all to look at when you have additional time. This is a much higher level overview. So here we have the community-based organization of community action agencies and what transportation services they provide. They include mobility service, door-to-door service, and curb-to-curb service. The transportation they provide can be used for employment purposes, medical appointments, pharmacy, education, shopping, or just to visit someone. They do need a 24-hour notice to schedule that. And below here, this 800 number and the capky.org has a lot of additional information for individuals and residents that may want to go that route if they don't qualify for an EMT. There's also public transportation, right? And that's for all individuals. The targeted counties transportation providers are listed here to have contact information for those particular counties and regions. So we've discussed the issue with access to transportation and the different things that are available to the public and to Medicaid members. So to summarize, transportation assistance is available by the state, MCOs, community-based organizations, and through public transportation, all of which are ADA compliant. Additional transportation support is needed in the Eastern Kentucky area, where are identified counties that consist of 50% or more of residents being Medicaid members can be focused on. We did find in this research that the highest utilization in these areas of transportation services is in Whitley County, Floyd, Knox, and Bell County. NEMT is the largest used transportation service for Medicaid members currently. And here, this is a clickable link where it has NEMT workbook that has a lot of good information on the ins and outs of the NEMT process and breaking down at a very understandable level how they all connect and how that works. We also found that the top value-added benefit for transportation used by members in 2022 in our area was the $50 gas card, bus pass, or Uber card that had limited eligibility requirements in order to receive it. The great news is that there are opportunities to increase access to transportation for our members. We can continue, and we will continue to evaluate ways to improve transportation and access to care for underserved communities. MCOs can and have began evaluating their value-added benefits related to transportation. Member and provider education on how to connect with the local community-based organizations like Community Action and public transportation options if the member does not qualify for NEMT services. Can improve communication regarding the NEMT process to members and to update that NEMT regulation. Now, again, located at the end here, this appendices has a lot of really good information that breaks down how exactly can members access these value-added benefits at the MCO level, and additional information for NEMT broker listings. So I definitely would recommend going through that. It's got a lot of good information as well. So with that, I'll be happy to take any questions, comments, concerns.
Thank you. Any questions or comments by members? Or by the MCOs for that matter? I did have a couple of questions myself.
Sure.
One is that I know that a sticking point for some families is that they have a car, even
Mhm.
if there's a car that is, and so can you explain a little bit more about the change in the regulation with the car? Because I know sometimes our families run into problems with, we have a car, but dad has to go to work or mom has to go to work, and we don't have a second car to get the child to appointments. So can you comment on that a little bit?
I can, but Justin Derringer would be even better. He's in charge of that proposal. So I wonder, Justin, are you on the call by chance?
He's not.
Ah, okay.
I was looking to see if maybe Jonathan was on for regulation questions, but I don't see him either.
Oh, goodness. Okay. Well, we can certainly get a more thorough answer when Justin is able to join. But we do recognize that that is a restriction holding people back from scheduling and being eligible for NEMT. And that's why it's part of that proposal. So with removing that restrictions, so that way, once if and when this is approved, if they have a vehicle in the home that's in their name, that should no longer be an issue, as long as there is a doctor's note stating they can't operate it or a mechanic's note saying that it's not operational.
Okay, so, but they still have to have a note, right, that says the vehicle isn't operational. So it really isn't gonna help with the issue if you have a car and somebody has to go to work, right?
Well, no, not necessarily. So, to the first proposal being to remove the current restriction. So right now, that's the restriction that you're talking about, and we are wanting that completely removed. However, say that there is some people have a lot of vehicles, left on their property. It's not working anymore, but it is potentially a resource. So the idea is to say that even though this vehicle is in this person's name, we have a mechanic's note saying that it's no longer operational. So we're not going to consider this in the eligibility determination.
Okay.
Yes.
Okay,
So,
thank you.
yeah, so good changes
I was
coming.
confused, yeah, okay.
I probably didn't articulate that right, so I apologize.
And is there a restriction on if it's if the visit is for a child? We know they have to have a parent because you were talking about parents having appointments and bringing children.
Mhm.
Is there a limit? Can a child have both parents? Can a child have one parent? Is there any restriction on that currently?
I can definitely take that back and verify with Office of Transportation since they're over that. But I would suspect that it would be very similar to that with the bringing the child and the transportation provider if they have the seats available because it's charged by each seat. But let me make sure and get back to you from the Office of Transportation so that way we get an official answer.
Because I would think you would have to, a child can't bring themselves. I mean, can't come by
Right.
themselves. So I feel like it would have to be 2 purchased seats for a child, at least for a child's visit.
Yes, the question is about both parents. I'm not sure about the both parents, but yes, of course, a guardian or parent would have at least one. Yes.
Okay.
Donna, this is Alicia Watley. I also had a question there. Can you all hear me now?
Yes.
Okay, perfect. Sorry, having internet issues today. Kind of in the same vein there, we've had some folks report to us difficulty with using the transportation when the appointment is for a child who's covered and the parent is using transportation to bring that child, but they also have siblings that the parent, needs to bring with them because they don't have childcare for siblings. So I just want to raise that as another barrier for families that have more than one child in the home and the parent doesn't have the ability to leave another child behind and needs to bring multiple children to the same appointment.
Absolutely. And that's a wonderful point. I'll definitely take that back to them at Office of Transportation. It is usually at the discretion of the individual transportation provider, and how they do that. But again, let me get you an official answer, because those are great questions.
Hi, Alicia. This is Dr. Terrio. That's exactly what I was going to say. And sometimes when the appointment is booked, there are no other passengers. But then by the time the driver comes to pick up the family, there are other passengers. And so, you know, kind of at the last minute, you can't fit your other kids in the car because there's other people in there. And you know, without a warning, the mom can't benefit from the ride. So I think it is dependent upon the not the broker, but the provider itself. But you know, things change and nothing's guaranteed, and that's part of the problem, at least for the pediatric population.
Anything else from anyone? Those are excellent. Thank you for bringing those up.
Donna, I just have one more question. This is Alicia again, and I apologize if this was mentioned, but do the transportation providers have car seats and other safety devices available for families that maybe don't have a car, so they don't have that with them?
Yes, they do. The transportation providers have that equipment in order to provide anyone that needs ADA compliance or to bring a child. So they do have that available, but with the provider agreeing to everything that we're talking about, not quite sure on that. So I'll definitely take that into account when asking Office of Transportation.
Thank you.
I also noticed that when you were talking about the value added benefit for Anthem subscribers, that it said over 18. This is a value for subscribers or for members over 18. So is there nothing available for children?
Not specifically. It is, and Anthem, if someone from Anthem's on here, you're more than welcome to come into the conversation. But no, each value-added benefit has its own requirement and eligibility. And so for theirs particularly, it would have to be for those age 18 and older in order to qualify to get that Uber card or bus pass, gas card.
Which may work if everyone in the family is a member, but not helpful to children if it's not available.
Absolutely.
If the family's not covered, right?
And see, that's really good points to bring up right now, because a lot of NCOs are reevaluating their value added benefit program and seeing how to make them better. So that's definitely something I hope all NCOs take on board as well.
Any other comments from members? Any other questions? Any other comments from the MCOs? So perhaps we can keep this under old business for our meeting in November to follow up on some of these questions that we put forth today.
Sounds good.
Okay, thank you.
Thank you, everyone.
Without any further questions or comments, I don't have anything under new business unless someone wants to bring up anything at this point. Okay, moving forward to the future topic discussions. Some things that we've brought up in the past were obesity, juvenile justice issues, bullying, and immunization updates. Anyone want to comment on any of those topics or recommend that be the topic for next meeting? or if there are any other topics that folks feel like we need to discuss at our November meeting.
Hey, Donna, this is Rachel Rarick again. Just to put that out there for everyone on the TAC, we are now currently working on a homelessness research project. So if that's something that the TAC wants to see, we'll be happy to present that if desired.
But that would be very helpful. That was the topic of our last meeting, and the MCOs talked about the various resources that they had for members. But yes, if there's additional information that's available, that I would very much appreciate that.
Absolutely.
Okay.
Rachel, my apologies. What did you say that was the homeless? Did you say that was a pilot program?
It's a homeless research project
Research.
for the state of Kentucky. Mm-hmm.
Thank you. I'm trying to do my follow-up notes for you guys.
Perfect. You're
Are
good.
there any other areas of social determinants of health that that DMS is working on right now, or that one is it right now?
Angie, I'm not sure if you want to speak to that. I know on the research end for research and analytics, transportation, and we're still working on, okay, now that we have this data and we have input from it, where can we go from here? How can we make it better? And so the next viewpoint would be for homelessness. So we're taking our time to thoroughly go through each one, but that's where we are on that currently.
Okay.
Thanks.
Yes, there's a lot of different variables that we're looking at for all equity and social determinants of health. So it's an overarching project, actually. So, you know, trying to address race and ethnicity issues as it relates to healthcare as well. So there will be a lot more to share in the maybe not so near future, but hopefully in the future.
So it sounds like for next meeting, we can talk a little bit more about the homelessness research project, and then have some follow-up in old business for additional questions that we raised for transportation issues. And it sounds like in the future, we're going to have a lot of discussions about what we're learning about social determinants of health and how we're addressing that. Any other thoughts about future topics or any information we need on these topics from either the MCOs or from DMS for next meeting? It sounds like maybe we'll have a lot of information on the homelessness project.
We may or may not. This is a new project we're starting, so we can't guarantee that it'll be ready for the next meeting.
Okay.
I'm maybe speaking a little out of turn. I know that the COVID vaccine was just approved, and I don't know if that's interesting to anybody as far as whether that will be provided or paid for. I'm assuming it would be if families wanted to get that for their children. Was it recommended for 6 months and up, or
Yes.
I know it's still waiting to be released, but I don't know if we wanted an update on that at any point, or if that's curious for anyone else. I just know that we've sure got a lot of it going on around, a lot of COVID right here in the clinic where I work right now. So it seems like it's alive and well.
Okay. Yes, that may be something to add. And then I think Dr. James has his hand up.
Yes. Immunizations is on the list, and just with the whole category of the immunizations that are on the listing that are being incentivized for health plans, is how do we create a collaboration? We know that we're going to have issues as far as those children under age 8 who may need 2 flu shots in the same season to start the process, and how we capture that. The issue of HPV immunizations. This is going to be a collaborative effort that we all have to be engaged in, so that as a pediatrician, it's these patients on weekends, but in a health plan during the week. I recognize that this is a complex issue, and it's difficult to get parents engaged. But I'd love to be part of whatever you have to do on that.
Okay. Okay.
Yeah,
So-
I'm sorry, Stuart, on with WellCare, and I was thinking the same thing. This is such a critical issue, the immunizations with children. If there's somehow, I don't know, all of us, maybe we could brainstorm a little bit, or, you know, the challenges. I know there are, you know, I think because of COVID vaccine misinformation, perhaps that has spilled over in like flu immunizations and others. And just, you know, there are different challenges, but I don't know if there's some way, you know, like Dr. James is talking about, we can collaborate or brainstorm, you know, especially, you know, with all of us, because we're whatever relevant stakeholders, but on that, how we can improve immunization, particularly for children.
Perhaps, there, I know there's data out there about vaccine hesitancy and our vaccination rates and how COVID, you know, the concern about the virus itself kept a lot of families out of healthcare for a period of time. Dr. Terrio, is that something that, is that some information that would be easy to share with the group so that we could have further discussions about how to incentivize, or I assume you all have that information
About the rates of the COVID vaccine or flu vaccine or all
just
vaccine?
just the overall. I know that there was pretty significant concern that because families stopped coming to the doctor's offices for a while around COVID because of their concern about exposure, that our immunization rates fell off pretty significantly throughout the country, not just in Kentucky. Do we know kind of where we are relative to, you know, I assume that we're moving back up, but I probably shouldn't assume that.
We're not back to where we were, but we can get that information together for you for the next meeting.
Okay.
I think that doing a barrier analysis can help, because part of it is the parents that hesitancy. Part of it has to do with EHRs. I feel very good, at least for a family health center, that when I'm seeing children, there is something that even I can handle really quickly to show what's there. But I know not all EHRs will make it easy for the physician to say, this is what is needed. There's staff time that's involved. There's the participation in VFC or not. All of these things are barriers that could be listed and analyzed, and that we could collaboratively find ways around those barriers.
Dr. Brashears from Anthem, I want to second everything Dr. James just said, and we'd be also happy to collaborate with the other MCOs and providers to try to solve this problem. I agree it's multifactorial, and we've kind of got to get to the root of it and start over with making patients and members trust us again, that their providers and insurance companies are doing the right things and encouraging these vaccines.
Okay. I see a message down in the chat from Jessica Veal about an early childhood vaccine task force. Jessica, would you like to comment on that, or?
Well, I just, I know Dr. Terrio can pull lots of lovely things together, but there are other folks in the Commonwealth connected with the cabinet and other spaces that are actively working on this. Some of the MCOs participate. I know we've got a meeting tomorrow specifically to talk about provider training opportunities. So I guess, not that I don't want Dr. Terrio to have to pull all that information together, but I guess maybe knowing that there's such an organization working on this, maybe the TAC might like them to come and present to the TAC, since I don't see any of you on those meetings myself. So
I think that would be very helpful to get as much information as we can. And what's going on out to kind of address that. I'm looking back up.
I think that's That's a good idea because they probably have access to more than just Medicaid information if you're interested in that versus, you know, what we would get is Medicaid.
Well, and I think, I think, there is a comment here from Matthew Walton that, you know, families get vaccines in different places. I think the state registry has been very helpful in pulling all of that information together for physicians or for providers so that we can pull that into our records. But I know certainly in Lexington, there was a practice that was not entering vaccines into the registry, and that practice closed, and there's a huge concern that children who had those vaccines, there's no documentation anywhere that families can get their hands on if they didn't already have it in their hands. So I don't know how widespread an issue that is in terms of, you know, how many practices throughout the state aren't using the state vaccine registry, and maybe that's information that we can either get from that task force or from DMS.
Yeah, I think that would be something that the task force would have, but it is a worry that people don't, you know, we're not a mandated state, so we have the registry, but it's only as good as, you know, data going in. So when you have a new kid, if they're up to date, hallelujah, that's great. But if they're not, you don't really know if they're up to date or, you know, if they're not based on what's in the registry. So I personally think it would be great to have a mandated registry so that we could trust it better than we can now. And I'm worried that a lot of people don't take VFC, and especially with the new RSV vaccine, that's what, $300, something like that, a shot, that it's going to be a problem getting that out there. You know, the hospitals aren't part of VFC. A lot of times you would give that dose in the hospital. So it you know, I do think looking at the barriers to VFC would be a big activity to take a hold of.
Dr. Grigsby, I know that has been a hot topic with that task force in particular, and they gave us a lovely map of where there were real concerns in terms of which counties are really lacking VFC providers. I think that might be of interest to you.
Dr. Terrio, this is Erin. Would you be able to point me to a contact person for that task force so I can invite them to our next meeting?
No, but maybe Jessica can.
Yeah, I would, yeah, it would probably be Crystal Back.
Okay, thank you.
Yeah, thank you, Erin. I was just going to ask that question. Who do we need to reach out to for that group? So thank you all. Thank you all for your inputs. It sounds like that perhaps the next meeting we really do want to focus on immunization barriers and kind of brainstorm. And we can certainly have some follow-up on the transportation issues, but perhaps we should give the homelessness research project maybe a little more time to gather information and perhaps move that one to January.
That sounds good.
I just want to add that I can, from a quality perspective, we are working on improving immunization rates for children as far as a value-based purchasing program with the MCO starting in 2024. So I can do a high-level overview of that if you'd like, of what that looks like.
Yes, that would be great. Thank you. So it sounds like we have a very, you know, in talking through this, we have a very robust amount of information that we can put together before the next meeting. And then perhaps put off the homelessness research project till our January 2024 meeting. Any other comments or questions from the group?
Dr. Grisby, Dr. Broshears from Anthem. I want to go back to your previous question. I didn't want to answer regarding our pediatric benefits regarding transportation without having the right answer for sure. But it appears that any member under the age of 18 who's enrolled with either a case manager or their member empowerment team can be eligible for that benefit. But the benefit does obviously the gift card does go to the parents in the parents' name, but they are eligible.
Wonderful, thank you. That's very helpful.
And I can get you those numbers if you'd like them, how many have received the benefit.
Thank you.
Thanks.
All right, anything else? So let's move to any recommendations that this group wants to take to the MAC. Anything we want, or do we want to collect more information on the transportation reform before we make any recommendations to the MAC?
Be good.
Okay. And Erin, when is the next MAC meeting?
The 27th? Nope, hold on. 28th, my apologies. That Thursday, the 28th.
Okay. Again, I keep saying I'm gonna block my clinic because that's my regular clinic day, but I'm gonna have to anticipate blocking it for the November MAC rather than for the September MAC. Are there any members who could attend the MAC on the 28th?
I have a conflict that day. I can't attend.
Okay. Thank you for attending in the past for us, Alicia. I know Dr. Smith and I both have clinic on Thursdays. And certainly I can. Erin, what is the date of the November MAC?
November, oh, MAC meeting, not your TAC meeting. My apologies. It is the 30th of November. And that's the last MAC meeting of the year.
And that is on a Thursday, correct?
Yes, ma'am.
Okay. I will see if I can block my clinic for that. It's at 10 o'clock. It's a morning.
It's from 10 to 12:30. Yes, ma'am.
Okay. Okay. If no one else can be there on the 28th, that's fine. I will try to get my clinic blocked. Okay. Our next meeting is November the 8th from 2 to 4. Is there anything else from any of the members of the TAC or from anyone from the MCOs or from DMS?
Hey, Donna, sorry, this is Rachel Rarick with DMS again. I just want to make sure that we get all of your questions addressed. Did you have an additional question regarding the NEMT regulation proposal? I want to make sure we reach out to Justin to get an answer if you still had outstanding questions.
I don't know that there were any other questions other than the ones we discussed. Did anyone? I know we talked about additional children. How many parents are allowed? We sort of got the answer about the car, removing the requirement that the family couldn't have a car in their name.
Right. Okay. All right.
Yeah,
If
I think
anything
that
else
was-
comes up, yeah,
Okay.
just let me know.
Okay, thank you.
Thank you.
And can anyone else remember anything else we discussed? Okay. Well, we've gotten a lot of information and we've done it very efficiently today. So I think we're going to be able to give the group the gift of time. If the members of the TAC can stay on, but I do need a motion to adjourn.
I motion to adjourn.
In a second.
I second.
Thank you. And all in favor? Okay. If the members of the TAC could stay on so we can discuss, I think we've set up next month's or next meeting's agenda, but I just want to double check. And thank you all for all the great information today and for the great participation and for your ideas about future topics. Thank you all for being here and for being so helpful, and we will adjourn. And thank you guys. We will see you again at 2:00 on November the 8th.
Thank y'all. Everybody have a great rest of the day.
Thank you.
Thank you.
Bye-bye.